హలో ఎవ్రీవన్, వెల్కమ్ టు విద్యా టీవీ. ఈ వీడియోలో మనం కొన్ని మోడల్ క్వశ్చన్స్ ఆఫ్ సింగరేణి జూనియర్ స్టాఫ్ నర్స్ డిస్కస్ చేద్దాం. రైట్, ఫస్ట్ వన్, వాట్ ఈస్ ద టర్మ్ ఫర్ a device used to take the place of a missing body part? The options are pronation, abduction, external rotation, and prosthesis. And the answer is option D, which is prosthesis. Right. Next one, when a client has left-sided weakness, what part of a sweater is put on first? Both sleeves, left sleeve, client's choice, right sleeve. And the answer is option C, client's choice. Next one, when helping a client who is recovering from a stroke to walk, the nurse aide should assist. Options: on the client's strong side, on the client's weak side, from behind the client with a wheelchair. And the answer is option B, which is on the client's weak side. Next question, the nurse aide is caring for a client who is agitated. The nurse aide should speak loudly so the client can hear the instructions, ask to reassign the care of this client, talk in a slow, calm, reassuring manner, tell the client to be quiet. And the answer is option C, that is talk in a slow, calm, reassuring manner. Next question, the purpose of padding side rails on the client's bed is to: options: use them as a restraint, have a place to connect the call signal, protect the client from injury, keep the client warm. And the answer is option C, that is protect the client from injury. Next question, exercise that move each muscle and joint are called as adduction, range of motion, abduction, and rotation. And the answer is option B, that is range of motion. Next question, the Heimlich maneuver is used for a client who has a bloody nose, a blocked airway, fallen out of bed, impaired eyesight. And the answer is a blocked airway, that is option B is the right answer, a blocked airway. Next question, the best communicate with a client who is totally deaf. The nurse aide should smile frequently and speak loudly, smile often and talk rapidly, avoid eye contact, write out information. And the answer is option D, that is write out information. Right. Next question. The nurse aide is asked by a confused client what day it is. The nurse aide should explain that memory loss is natural and the date is not important. Ignore the request. Point to the date on a calendar and say the date. Provide the date and then test the client later. And the answer is option C, which is point to the date on the calendar and say the date. And next question is, a nurse aide must wear gloves when feeding a client, doing pericare, giving a back rub, doing range of motion. And the answer is option B, that is when doing a pericare. Next question. When getting ready to dress a client, the nurse aide should get the first clothes the nurse aide can reach in the closest, give the client a choice of what to wear, use the clothes the client wore the day before, next, choose clothes that the nurse aide personally likes. And the answer is option B, that is give the client a choice of what to wear. Next one. If the nurse aide discovers fire in client's room, the first thing to do is call the nurse in charge, try to put out the fire, open a window, remove the client. And the answer is option D, that is remove the client. Next question. In order to communicate clearly with a client who has hearing loss, the nurse aide should speak in a high pitched tone of voice, stand behind the client when speaking, speak in a loud and slow manner, look directly at the client when speaking. And the answer is look directly at the point when speaking. Thank you. That's all for this video.